Welcome everyone to the Exploring Chiropractic Claims Data webinar. I'm Tom Ryan with Provider Outreach and Education, and I'll be your presenter today. Today I'm joined by Ashley from my team. She's going to help me with that chat. She's going to put some links in there for you, answer some questions, other things like that. Let's do a little housekeeping to get started. If you have not already done so, please feel free to download today's presentation. It is available on our website in the Training Center. So you'd go to wpsgha.com, go to right across the top in the middle, Training Center, then Live Events, locate this event and download the material. Also, we will put this information back up onto the website in the encore presentations. So we're recording this presentation. It will be made into an encore within 30 days, and then it will be available for 60 to 90 days. Our goal is to then give you the presentation again. So if you needed it for a coworker, etc., you can definitely do that. As I said, the encore presentation is where we will locate a link to it. It will actually be housed in YouTube, and that gives you the opportunity to review the material as well. If you have questions, concerns, or comments, please open the chat feature. The chat feature will allow you to submit those as we go. We do want to answer them if we can. Otherwise, we'll do a wrap up and send them out to you. And last, just as something to keep in mind, we will provide you with a survey at the end. The survey gives you the opportunity to provide us feedback. What we're looking for is, what did we do well on this education? What does WPS do well as your claims processor? And then, do you have suggestions? So the good, the bad, and the ugly. The good, what did I do well? What does WPS do well? The bad, what do we need to improve on for this presentation? I always call the ugly my PowerPoint or the websites that I'm showing you. If I do have to give you a resource or show you a resource, was it effective? Is it something that was useful for you? Oops. Quick disclaimer, again, this material is to assist you. The actual rules, regulations will always override any educational material. We will answer any questions based on the information given and the facts that are within that. Any details omitted could change the answer for the final coverage, especially with chiropractic care and some of the ABN questions that I did get, so I just want to make you guys aware of that. Last, all of the current information that would be available for current rules, laws, and regulations is available on the CMS website, so we will go through more information there, and I will try to give you different resources based on the questions that you have asked. I will be using CPT codes during this presentation. There are 3 of them that Medicare considers payable, and we'll talk more about that. But this is just to say that we don't own the rights to them. The AMA does own the rights to them, and that they have not reviewed this content, so they do not recommend, or they are not supporting this content. They're just saying, hey, we do own the rights to these CPT codes. If you want to learn more, please feel free to read this in its entirety. So what is our goal today? Well, our goal is to help you avoid those rejections and denials on claims for chiropractic care. So what we did is we looked at data, and that's where we're coming from. So what are we going to do to get through that? Well, we're going to do a basic benefit overview. Now, this came from a couple of questions and some general information that you guys asked for. We will look at rejections, and then we're going to look at denials. So what is being rejected, and then I'll explain what a rejection is, and what is being denied, and I'll explain what that is. We'll talk about some fixes and other things like that. Also, though, be prepared with any questions that you have. I did build in quite a chunk of time at the end for some of that. We'll see how much is used up as we go through with the pre-submitted questions. Pre-submitted questions we're taking during registration, which brings us to the first one where they were asked, can we just cover some general information on chiropractic coverage? Sure, I can do that. The general information is what this will provide. It's a brief overview. It does start with provider enrollment. We'll talk about that. I do want to let everyone know that I was asked about a law that would update the chiropractic benefit. The law is still in draft within Congress. It has not been passed in any of the houses of representatives or the Senate, so not that I know of anyway, when I last checked. Now, it would update the chiropractic benefits based on that law. So I can't help you with that law until there's more information about it. So we'll talk more about that as it gets passed into law. So I would look more in the future if we do have anything. So documentation. Now, for those of you that are not aware, documentation is the key to getting paid from Medicare. It's the key to proving that it's medically necessary. We're not going to go through a documentation course because we just did one on 915. That 915 course is available for you to watch and listen to. It is available on our website. It's also available on our YouTube channel as an encore presentation. So please feel free to go ahead and look at that. The information within that, though, also then leads to coding and billing information, which is available as part of the billing and coding policy information, and there's an article that goes with that. So I had actually put both of those two links in there. So as we talk about documentation, that's going to give you the key, and that's within the LCD. It's talked more about in the documentation of chiropractic services, but also please don't forget that you want to look at the billing and coding chiropractic, and that's going to give you more information that you may need. So first, there is a limitation to the chiropractor's benefit. And the reason the limitation was put in place is the way that the law was passed. The law allows for manual spinal manipulation to be covered. That is all that a chiropractor is covered for. So the exams, other things are not covered. Also, any ordered or referred services from a chiropractor are not covered. That means that if a chiropractor orders an x-ray, it's not covered because it's a chiropractor ordering it, even if they don't do it in their office. So that is then that is then given to us so that we can practically use that in the Medicare Benefit Policy Manual. If you go into Chapter 15, it's called Covered Medical and Other Health Services, and it's Section 240. This is where you're going to see a little bit about that limited coverage. I was asked just kind of to review that, so let's take a quick look at that. The Medicare Benefit Policy Manual is on the CMS website, and that's cms.gov. What happens on the CMS website is anything related to Medicare will be under the term Medicare, and then this is under regulations and guidance. So we're going to go to regulations and guidance, and then we're going to go to manuals. The reason that it's under the regulations and guidance and manuals tab is that this is our daily operating instructions. Okay. Inside the daily operating instructions, you're going to scroll down and you're going to see a bunch of different manuals. As I said, this is the claims processing manual. And inside the claims processing manual, you'll see a lot of different manuals. And so then you have to be, okay, which one was it? Well, let's just refresh your mind and mine. It's Chapter 15, Section 240. So we want to find Chapter 15, covered. Oh, I'm sorry, I'm in the Medicare Claims Processing Manual, and I should be in the Medicare Benefit Policy Manual. That explains it. Sorry about that. If we go to Chapter 15, you'll see covered medical and other health services. And I'm going to tell you this is a big old list. It's got a lot of information in it, and you can scroll through all of those different pieces of information. It will cover a variety of pieces. But in particular, if you come down, here's where you're going to see chiropractic services and what is covered. Okay. And this is where we get our limited coverage for it, because it actually says, okay, if I skipped here, it says manual manipulation, explains about that. It actually tells us where the section is that says this is covered, what could be used to look at it. All of those are different things that are given. Okay. Tells us how to demonstrate this. This is that part that we talked about with the documentation. This is what you're trying to demonstrate. You have to meet these requirements. Now, this doesn't mean you get paid for doing certain things, right? We have talked about that already. So with that said, I would recommend taking the Medicare Benefit Policy Manual. Please make sure you're in that one, not the Claims Processing Manual, and go to Chapter 15. And just read through that information if you're not sure what is meant by limited coverage. Again, if that law that is sitting out there right now, and it's in debate, if that law gets passed, that manual will be updated. That manual has to be updated through a process, and it's going to create a transmittal or a change request. And that will then update information and allow us to process, tell us when we should, one, start the benefit, and two, implement the changes to the system. Just because a benefit is payable doesn't mean that the system will always accept the coding for it. Some of you guys have probably experienced that before. So what we do know right now, it is only for manual spinal manipulation, and that's all Medicare will cover for that. I was specifically asked about enrollment, if a chiro actually needs to enroll in Medicare. The answer is, if you see a Medicare patient, then yes, you need to enroll. If you see a Medicare patient, then yes, you need to enroll. This does not mean that you have to see Medicare patients. If you've never seen a Medicare patient and you have no intention of seeing a Medicare patient, then no, you don't need to enroll. But when you do enroll, you do have to provide a state license. The state license then allows for you to be considered a Medicare provider. It is something that is part of our requirements. You must enroll with the CMS 855I or the electronic version, which is called PCOS. Both of those are linked there. You do need to follow the information in the Code of Federal Regulations, Title 42, Section 410.21. Now, this is what a chiropractor has to meet the Medicare criteria for enrollment. If not, you will not be considered for enrollment, and your enrollment will actually be denied and saying, hey, you're not able to enroll yet for whatever the reason is. A little bit different than if you don't fill out a proper form where we'll deny saying, hey, you didn't do this correctly. This means you're not eligible to be in Medicare. Okay, so we want to make sure you're aware of where this Code of Federal Regulations is in this section. This is a link. So if I just simply select the 410.21 and I actually have downloaded the PowerPoint, it will open the Code of Federal Regulation area that you need to go to. And make sure that you're looking through until you find the section that you need, which again, 0.21, so 0.1, 0.2, and then you go through and you can find all the different parts that you need for it. So we just want to make sure you're more aware of what you're doing with these different sections. And part of that within the Medicare chiropractic benefit, and the reason that we refer you back to some of those definitions is just to make sure that you're actually meeting everything you need to. Do we know the number one reason chiropractors lose their billing privileges for Medicare? This was a question that was posed to us about enrollment. And while you may not think that it's about enrollment, the actual number one reason is that you did not keep your record accurate, current, and up to date within the provider enrollment system. That's why you lose your billing privileges. This is also because someone did not do their revalidation, which is an enrollment requirement. Make sure that you have your state license current. It makes sure that all of your billing information is current. It makes sure that, like if you use a biller or a coder or a clearinghouse or any of those, it makes sure all that information is gathered within the provider enrollment chain and ownership system, or PCOS. That is actually the number one reason that you lose your billing privileges from Medicare. So I thought I would just address that and make sure that that was also put into there. So it is important to make sure that when you get a letter from Medicare and it says, hey, you need to revalidate, that you do complete the revalidation and that you do it in its full. I will tell you that there was also a question asked about a recommendation for revalidation. I always recommend using the electronic enrollment system. It may take a little bit to get set up within it, but once you are set up or your representative is set up, you can actually see what Medicare has within the system and you can say, yes, that's accurate data and move on, versus like the paper 855I, you have to complete all the sections, and anything that you miss, including not crossing a T or dotting an I, can cause a rejection. The electronic enrollment system, while it is a bit more complex to get started with, will actually really help you. All right. Next, coding and billing of chiropractic services. This is that article that we did talk a little bit about. So while the policy talks about, while the information talks about when it's relevant, and that's in the internet only manual, that's in that benefit policy section, this then says, okay, this is what that translates to for coding. So manual spinal manipulation gives you 3 codes. They are listed here. I want you to note that 98943 is not one of the codes that we pay. Okay, so we don't do that. What we will look at is these 3 codes, and then of course you need to support that within the documentation. The codes are broken up by the number of regions adjusted. So you're probably familiar with that. You also then have a group of diagnosis codes, and this is in your local coverage article A56273. And it'll tell you if you're using these codes, your subluxation code must go first, followed by something else. And that's where it's important to make sure you have that. What I'd like to do is just take a moment before we leave this and go to the Medicare coverage database, because there was also a couple of questions tied to not covered services or items that are not there, and that's also listed within this coding and billing article. So let's take a minute and go back to the CMS website and go to the Medicare coverage database. So on the CMS website, you can go ahead and go Medicare coverage database, which is fine. You could also just simply hit search and do MCD, which is the acronym for Medicare coverage database. However you want to do it is fine. What you can do then is search however you want. I'm going to say let's narrow it down. I'm just going to use Indiana. Again, it could be Iowa, Kansas, Missouri, Nebraska, Indiana, or Michigan. Pick any one. And I'm going to say Chiro. And as you see, it automatically brings it up and says, this is WPS. That's important because if it's not labeled WPS, then that tells us that it's not ours. We aren't held relevant to it, except for anything that would be in italics. We're always held relevant to anything in italics. But other than that, it wouldn't necessarily be our policy from WPS. Now, this does say it's not related to an LCD reference. I know I've used that term a couple different times. That's a local coverage determination. And what I really should be saying is it's not related to the internet-only manual. The Medicare benefit policy is where that information is. We looked at that. So this helps give us information based on that Medicare benefit policy manual versus an actual LCD. Okay. It does talk a little bit just about some general information up here on the top. You can read through any of that. Here's where we talk about the information that I was referring to within that Medicare benefit policy manual. This is what the article is defining, and what we're trying to do with it is take it and make it into a usable document so you can code from it. You can get the procedure codes, the modifiers, all of that. That's what this article will do. So that's why it's located where it is. It goes through, kind of gives you a little bit more if you need a definition of what a chiropractor is, fees and adjustments, any of that. Here is some information about part, the pain, asymmetry, range of motion, and tissue, tone changes. This is an evaluation tool that can be used. The evaluation, or not can be used, that has to be used. It's part of that documentation component. So then as we get down in, you'll see a little bit more about everything. Then we hit this area where it actually tells us, okay, here's the documentation requirements and you're proving medical necessity. Again, that's in that earlier webinar that we did a couple weeks ago. Here's the manual manipulation. Here's the 3 codes, which I did already mention. And then it goes on to say, found in group 1 under not containing an AT modifier will be considered not medically necessary. AT modifier, and we'll talk more about that in just a little bit because that is one of the denials. And then it goes through all the different pieces of information that you need. So we go down through, this is one of the areas that we got a question on, and which is why I brought us out here. Okay. What's not covered for a chiropractor? Well, non-covered or not covered means that it will never be covered and an ABN is not required for these services. Okay, so laboratory, x-ray, office visits, anything like that list right here. Okay. Again, here's where it says this also does not cover 98943, which does include these areas. So we know that those are all not covered for Medicare. Therefore, when you code them, you could code anything for any of this, including the 98943, with a modifier GY, never covered. Why do we recommend that GY modifier? Does anyone know? It actually helps the claim process faster, and it indicates that we know, that you know, so that Medicare now knows that you know it's not covered. Don't consider it for medical necessity. Don't look anything further into it. So the ones that would not be coded with the GY are those manual spinal manipulations, which are the 98940 to 98942. This 3 codes. These are covered. They may not be covered today for a diagnosis, and we'll talk more about that because that's when you want to give an ABN. If you continue down, you can actually see, okay, here's my group 1 codes. It's going to say, okay, here's the codes, the procedure codes. This one's not covered. And then we get into the ICD-10s, and it will actually explain. And this is one thing that some people have missed is diagnosis codes must be coded to the highest level of specificity. And then it tells us where different things go and information you need to know. So we want to make sure we have all of these different group 1, group 2 codes into the correct coding places and everything is done correctly. Also, if you're looking for something, oops, I'm sorry, I scrolled by this. These are generally require short-term treatment codes. So if you're using this type of a diagnosis code and it's not requiring a short-term, okay, now why? That needs to be documented. We need to understand the difference of why this is being used and it's not short-term. So that's where we want to look. It'll also say that these are the only covered diagnosis codes that support medical necessity. So they're the primary. Okay. It just kind of helps you go through that. So I should have pointed that out as well. So that is a denial, and we'll talk more about that denial, but you can see that each one is then given to different types of information. And as we go through that, those are something that we are expecting to be on the claim, but also will cause denials, okay? The next slide is about the modifiers. Oops, sorry, we already located that. It's about the modifiers. And the first one is for AT, and that's active treatment. And you actually saw that within that LCD article that said, hey, if you are, I'm sorry, within the coding article that said, hey, it has to be coded with the modifier AT to indicate to us that it's active treatment. If it's not coded with an AT, you would want to code it with a GA if you gave an advanced beneficiary notice of non-coverage. Do you know why? Because those three codes for chiropractor are payable if they had a different diagnosis today. If this was something that this person needed it for this reason today, it would be payable. But because they don't need it for this reason today, now it's not payable. So there's only three codes you need to use that on. And we really want to make sure that you're well aware of that when we talk about that. And remember, that's the 98940 to 98942. And you want to make sure you're using that. If it's any other code, then no, you don't need a GA and you don't need to give an ABN. Now, again, the ABN is the Advanced Beneficiary Notice of Non-Coverage. Oop, whoa. Sorry. Yeah, I hit my wheel and just totally messed everything up. Okay, there we go. And the ABN is something that you give to inform the patient that Medicare will not consider their service today as medically necessary or may not consider their service as medically necessary. What the two modifiers will do: one, the GA says take it through the entire claims processing system, don't stop it, don't look at it any other way. Once you get to the end, should you determine that this does not meet medical necessity Medicare, they'll want to assign this to patient liability. We already told them. Okay, this is not the same as it's never covered by Medicare. It's not covered by Medicare, whatever term you want to use. That one is coded with a GY to say, yeah, we know it's patient liability. We told the patient. They're telling us that we want to bill it. Maybe you need it for secondary insurance, whatever the situation is. The GA means, yes, this service could potentially be covered. However, we don't believe it is. Okay. Now, one of the things that actually happens with a contradictory here is people will say, hey, we don't believe it's covered, but we're going to say it's active treatment. Which is it? Is it active treatment and you want us to take a look at it and cover it, or is it not active treatment because you don't believe it's covered? We don't know that, and our system doesn't like that. That's a modifier discrepancy. I was asked a question about modifier GZ, and basically you're saying, hey, we recognize that this is not active treatment for whatever reason, but we also didn't give an ABN. So GZ is submitted. GZ, for the most part, will come back as a provider liability because you should have told the patient, you should have given them an ABN. Therefore, it's going to come back as a provider liability. Okay. Now, if a patient says, don't bill that to Medicare, do they have that right? Absolutely. Please have them sign a statement stating, hey, we don't want you to bill Medicare. Now, they can tell you not to bill for whatever reason. You don't need to bill that. You've got a signed document by them saying, nope, don't bill it to Medicare. Now, they have 1 year to change their mind and say, bill Medicare. Does anyone know why it's 1 year? 1 year from the date of service. That's the timely filing limit. That's why they have that, okay? Don't submit to Medicare in that case. Just have them do a self-pay or whatever they want to do there, okay? If If you put the GA or the GZ on there, we will consider the claim. We will consider the charges. If you put the GZ, we're probably going to assign it to contractual obligation. And if you put the GA, then we're going to be able to request the medical records. We're going to request the medical records. So that's what we would recommend if you have that situation that happens for you with using the appropriate modifiers. All right. What's next? Ooh. Well, next is the data. And what we're going to talk about next is just the parameters that we used to get the data, because it's important for you to understand that when we looked at it, I didn't look at all data for everything and be like, okay, here we go. So what parameters? Well, the first thing that we did is we said we only want to know about claims billed to the Medicare, to the multi-carrier system, or MCS, that's billed in a 1500 claim form or an 837P electronic claim. With that, we then only want to look at provider specialty 35, which is chiropractic claims. We also only want to look at between 4/1 and 6/30. That's kind of the dates that we use. The reason that I did some of those is to allow for appeals and things like that. So that's why we used a refresh date of 7/14. So that's where the data came from. And so the next few ones are just important things to remember when we look at important pieces and components. So the first set of data that we actually looked at was the rejections data. So what is a rejection? In the multi-carrier system, or MCS, a rejection is simply something that cannot be adjudicated, can't be adjudicated. This something is a claim. This claim has such a key piece of missing information that we can't process it. And we'll talk more about some of those pieces of information that could be missing, okay? So first of all, it's done by line rejections. It's not done by an overall claim rejection. So when we look at it, we look at the individual lines. That's where we assign the numbers to. So in this case, it was 35,123 lines in that 3-month period. These are also commonly, for provider specialty 35, and these are also commonly referred to as unprocessable claims. We can't do anything with them. You have to fix them before we can even consider them for processing. So what types of things would Medicare reject? This first one is a very generalized advice code, and it lacks information needed. Unfortunately, on this one, you do have to look at the individual code. So what I have here is the general reason code, which is the financial liability, saying, hey, we're not paying this, but we need some more stuff. What stuff do we need? Now you have to go to the remarks code. And without that remarks code, you won't know what's missing. You won't know what's missing. This accounts for 12,840 of those 35,000 lines. So it's quite a high number, and it's why we want to do that. Somebody did ask, I'm not seeing all the coding information or all of the codes on my remit notice. I'm not really sure which codes you were talking about, whether it's the remarks codes or the reason codes or what's happening with your remit notice and why you're not seeing that. But this one, you do need that for. I will tell you that one way to do that is to go into our website. On our website, you will actually have the opportunity to enter into our secure portal. Let me show you that. And the secure portal is called Secure Net Access Portal, or SNAP. Our website is wpsgha.com. Right here, you can log in. You do have to be granted access to a provider's NPI, and that can be done through an NPI administrator. So if you don't know and you want to find out more about any of those, go ahead and look that up. But I'm going to use the portal user manual because I can't log into the portal. There's too much in there that I can't see. That is the protected health information and personally identifiable information. So we just get access through the portal user manual. When you come into that, you can see there's a variety of different options and sections. If you want to download the full manual, go up here to the download button. Otherwise, just pick the section that you want. And I'm just going to scroll down. So if you don't like that, please, by all means, look away. We're going to go to the claims section. And you can see you can get a claim status right here. This will give you what you need. So I want to make sure that you're aware of how to do that, or that it is through there. And by doing this claim status, you're able to see both the codes that you need, the remarks reason code and the remarks remarks code, the other codes. So you'll be able to get everything you need right here. Okay, so I do recommend that you take a look at that. Without those two codes, you're not going to have what you need to address this one. And because this is used for such a variety of items, it is something that you will want to consider downloading or looking it up. Okay. I'm going to keep going down here. And if you notice under remittance advice, you can actually get a remittance advice and some other different pieces of information down here. So I would recommend that you take a look at the notices if you need that. Okay. So if you need a remittance advice search, you can get that. It will also then give you if we offset something. So there's a lot of basic information back and forth with that. Again, reason and remarks codes from the remittance advice are both on there. I'm not sure what the person meant other than that by the question. The question was kind of generic-y for me to help you with anything more than that. So if you have some more details, I'd love that, but I'd love you to put that in chat for me. Modifier issues, we talked about this. There's 10,943 of these lines. So again, very significant, very close to the other one, except this one is very specific. First, does it have the AT attached? Does it have a modifier on there? If not, the system's going to say, wait, we got something going on. What's going on? Well, is it not valid? One of the claims that we looked at that actually hit for this had a modifier 25 on it. I'm like, don't see an evaluation and management code on this. One of them had a modifier KX. I'm not sure what they were attesting to with the KX, but it should have been an AT that this was medically necessary. I think that might have been what it was. That very simply could have been just a keying error. They were keying through it and was like, oh man, all right. So that does happen and we do understand that, but please remember that there are limited modifiers valid for chiropractic claims. Again, AT, absolutely. GY, yes. GA, yes. GX, yes. GZ, yes. Those are your basic modifiers. So AT would be there, but again, other things would not be valid. We don't know what you're trying to do with it. And so if that happens, the system automatically says, well, what are you doing with this? What you could do if you want to know if our system allows for a modifier with a chiropractic claim that is payable. So we gave you those chiropractic claims before, the 98940 to 98942, and what you could do is call customer service. But don't call and say, I want to code this. They're not going to be able to help you through that. What you want to say is something like, does the Medicare system allow 25 procedure code 98940 with modifier 25? That's a yes or no. It's really look in the system and can I put this on there? I know what I want to code, but can I do that? It's two different questions. You're not asking for additional information. Sometimes we're referred back to the modifier fact sheets on the WPS website, and there's a whole list of them. But I really want to just encourage you to stop. Look at the modifiers you're using, and are they one, AT, active treatment, GA, I have assigned ABN, GY, doesn't cover it for chiropractor, GX, should have got an ABN and didn't, or I'm sorry, should have got an ABN but not needed, GY, GZ, and GZ should be, all of those should be your base ones, okay? Hopefully I got those, not sure what you needed there. I was very specifically asked for a question of the difference between GY and GX. And as I stated, GY indicates this service is not covered. Now, it could be not covered because it's never covered for a chiropractor, right? The chiropractor has a limited scope and there are 3 payable codes. If it's anything outside those 3 payable codes, when you read the documentation, GY, let the system know, nope, we know that. GX also indicates that it's not covered. It's not covered. But what GX also does is says, I gave an ABN with that, an advanced beneficiary notice of non-coverage. Did you have to give an ABN? No, but you did. You told the patient it's not covered. That's not the same as I had to give one, and I want to let you be aware of that. So if you give an ABN, you're going to code GX. If you don't give an ABN, you're going to code GY when the service is never covered or not covered or non-covered, whatever you want to say by Medicare. Okay. If it was manual spinal manipulation, and it's one of those 3 codes, and the diagnosis does not support that within that article, then it's GA. If you give an ABN or GZ, I should have given ABN, but I didn't. Okay. Beginning treatment date. This is just one that has to be on there for all chiropractic claims, and it is a requirement from CMS, so we have to reject if we don't have it. And so it is causing about 4,823, and it's actually the first day you began treating them. This could be the day of the evaluation, this could be a variety of other things, but it is one that is very common, or one of the more common ones. Okay. And actually on the slide I built in, the loop and the item that we're looking for that in if you're billing a 1500 or an 837 piece. So please make sure you check and make sure it's there. If we're not seeing it and you are billing electronically and you're like, but it's there, then you need to have your clearinghouse or your electronic software vendor, whoever that happens to be, contact our electronic data interchange department and figure out where the communication is failing. That was a question that happened. Someone said, well, we have it there, we see it, you're not getting it. Okay, well then what we need you to do is to figure out why. In the meantime, you can actually bill on paper claim forms, and you'll want to ask for an ASCA, ASCA, Administrative Simplification Compliance Act exception so that you can bill those paper claims. I know I just threw a lot at you on that little one right there, but the beginning treatment date, for whatever reason from this provider was tending to be an issue, and they are billing it electronically. They see it, we don't. That is some kind of electronic miscommunication. Something's happening where it's not coming through correctly to us, and it has to be figured out. In the meantime, though, you may need to bill in the 1500 claim form because we're not going to pay until we get that. The next one is just a verification. It means that you didn't check eligibility before submitting to Medicare, and it's 1,356, and it simply says it should go to Medicare. Railroad retirement versus traditional fee-for-service Medicare, the Medicare administrative contractor for A and B, which is who we are. Palmetto is the railroad retirement contractor. They handle that. So you just want to make sure you have the right type of Medicare. The most common place to locate this information is actually going to be on the Medicare card that you get from the patient. What I did is put a sample card on the screen, and you can see right across the bottom in that red banner, it says Railroad Retirement Board. The next rejection says, I have nothing for Medicare primary insurance, and that I see that there's a record there, but we don't have anything. So what you have to do is go out and check the record. Okay, is there primary insurance? So this is in an eligibility record. It is on the portal in the eligibility section. There's a special tab for it. You could do it on the 270, 271 HIPAA standard transaction that's available on the CMS website. There's a variety of pieces of information on that. But we do need you to make sure that that information is there. Question came in, and the reason that this was put into this is they check the record. It's not correct. What do we do? Well, first, it's ultimately the patient's responsibility to update their record. Now, please don't shoot the messenger on this one. We all understand that sometimes the patient isn't willing to do that. So yes, you can bill the primary and then bill us saying, hey, yep, we went. They're not paying it because they're not eligible. You can get a letter on their letterhead and get that to the Benefit Coordination and Recovery Center. But without something, we will not process this claim. Or you can have the patient contact the Benefit Coordination and Recovery Center, update the record, and that will let all of your claims go through versus a one-time claim update. So it just depends on what's happening there. I was asked about, do we track trending? Do we track things that up and down, and how does that work? So I thought, okay, I'll just put a little bit of data. I'm not going to go really far into this, but you can see unable to obtain primary insurance is trending up right now at 46,950%. This is the type of trending that we do. What are we looking for? What's going on? Clinic number missing or incomplete. Again, that's the number where the facility was, facility name and address or PIN is missing, incomplete information, and then location of service missing or incomplete. So those are the types of things that we look at and we say, okay, what's going up, what's going down, what might we need to educate on? And then we actually look at the individual denials, and you can see a lot of those will tie back to that as well. So these may be more than one line, and which tied back to the individual denials, which then led to a certain amount of information. But I will tell you my rejection trending information came from the exact same timeframes that we had used. Okay. The denials. So this means that the claim was adjudicated. Commonly, these types of things will be um, applied appeal rights. So an MA01 as a remarks code, which just indicates, hey, you do have an appeal right on this. So we do see this quite differently than we do see a rejection. Now, a denial, again, is a lot higher. We have many more of those. So we have 201, 446 denial lines versus the 12,000 or whatever it was for rejections, which is much lower. So there's a big difference, big difference. And that's where we really look at it. And our system is built, I'm sorry, it's 35,000 rejected lines versus 201 denied lines. And so what happens with a denial is, one, is it a denial that's a technical denial? It's never covered. We talked about that. That's your GY codes, those types of things. Is it something that is possibly covered, but not covered today based on diagnosis or based on lack of documentation, something like that? Is it a denial that is something saying, hey, it should have been a different plan? So unlike Railroad Medicare, which is still traditional fee-for-service Medicare, there's Medicare Advantage. Those are all types of denials. So we'll talk a little bit more about those as we go through. So let's break a little bit off of that 201,000 there. The first denial that we actually have happening is services not covered. It literally means this service is not covered by a chiropractor. Well, we talked about that, right? Medicare does cover 3 services, and those are those manual spinal manipulations. Well, it covers 1 service divided by 3 codes. If it's not that, then this is the denial that's applied. And I'm going to tell you, this is not something, when we say it's an enrollment-based denial, that means you enrolled as a chiropractor and Medicare doesn't cover this service for a chiropractor. Again, you may be billing it for a secondary insurance. You may be billing it because the patient told you to. How many of you ever had that happen? Hey, I want this billed to Medicare, and you're like, okay, but they're not going to cover it. In any of these cases, that's what's happening. When we say it's an enrollment-based denial, it's not based on the fact that your enrollment record isn't complete. It's based on the fact that you enrolled as a chiropractor with the specialty 35 in the enrollment system, PECOS, the Provider Enrollment Chain and Ownership System. That's what's causing this denial. Not right, not wrong, it just is what it is. Somebody did ask if I have a recommendation for a modifier that will just get this through the system so you can get it onto secondary faster. I'm always going to recommend that modifier GY. Tell us it's not covered right away. You could put the GX if you gave an ABN. Either one is fine. They both do the same thing. We also have not covered, it's not a Medicare benefit, bill the patient, and the patient does have appeal rights. Now, this is usually one that is not covered based on the diagnosis code. It doesn't have the AT modifier on it. So you gave the patient the ABN, you put the GA on it. Okay, it's not covered. Well, why isn't it covered? Well, it's not covered not because it's never covered, but just because it's considered not covered based on the diagnosis code. Okay, it's again, without the ABN being given, however, this will be a provider write-off. So I want to make sure you're doing that correctly. Again, we just don't see the AT, the active treatment, right? We don't see that. A couple of things that I did say there. The patient does have appeal rights on this, and that's important. The provider does not. If you wanted to fix this claim and you want it to be covered, then you would submit a new claim removing the GA, but what would you need to put on it? The AT. That's how you fix this claim. It's not an appealable issue. And then let it go back through. Okay. So unlike not covered, which is another form of that, this is just another denial for the same thing. This one is actually a diagnosis driven one. So when we're looking at it, the subluxation is not the first diagnosis code. That's actually specified within that article that I showed you. So I do want to make sure you go back to that article and read that. If that happens, then this condition not covered comes up. It works the exact same way as the not covered one, with the exception of the fact that this is diagnosis driven because the subluxation isn't the first code. And in the article, we explain that we want the subluxation as the first code. Everything else should be supplementary. That's what drives this one to be a denial versus the other one. So while they're both not covered, this one is condition not covered versus the general not covered. The next one is Part C plans. And remember, I said Railroad Medicare isn't unprocessable. We didn't process it because it is Part A and B, just not where you're supposed to send it to, and that's Palmetto. This one is a Part C plan, which is a patient-elected managed care plan, otherwise known as Medicare Advantage. Part C. It is a separate form of Medicare administered by a private health insurance company. And because it's a private health insurance company, we'll deny it. We did have a question come in that said this patient no longer has that Part C plan, but you're continuing to deny for that plan. What do we do? Really, the answer is someone has to get that Medicare Advantage plan to update the record that goes to the common working file through the Social Security Administration. And once that record updates, then it will release the Medicare claims processing systems, the MCS system, to process the claim. So we can't really help you with it or do anything with that, whether it's the patient themselves or you update. Somehow it has to go back to that Medicare Advantage plan or that Part C plan, and they have to update it. I will tell you there is a separate tab for Medicare Advantage plans or Part C plans. It's called MA on the portal, and you can look up and see if they actually do have one. So we always recommend checking that and making sure that information is current and update before you send a claim. If you do get this type of a denial, you can always check to make sure it's been updated before sending a new claim, because if you send a new claim and it still shows the information, it's not going to do anything. We're just going to keep denying it. Okay. The last one that I do just want to kind of go over is the provider denial. Services are not paid for this provider. It's not covered based on the provider specialty. Now, this one is typically done for something like an evaluation and management service. Maybe you're doing an exam, maybe you're doing an x-ray to prove medical necessity, so you're billing that to Medicare, but Medicare is saying, hey, we don't cover that for a chiro. That's what creates this one. So it is really something that we're saying, hey, we won't cover that. So hopefully that also makes sense. A little bit about denial trends, because I was asked for some base denial trends. So correction to an error. So someone's trying to correct something. It's up 3,300%. Duplicate charges already submitted. In other words, you sent us that claim, you're sending it to us again, but you didn't change anything. That's up 3,000%. And you can read through the rest of them. These are all based in percentages. All right. Let's move on to some question and answers. I'd really like you to add question and answers directly into the chat at this time. I'll stop in just a moment, but I do want to get through a couple of pre-submitted questions that I don't think I've gathered or answered yet. And because this one is so important, and I know I've talked about it, but I do want to talk about it again. What services or codes need to be included on the ABN are non-covered services required to be on the ABN. Remember, the services and code that need, the keyword is need, are the 98940 and 98942. So 98941 and 98942. When they do not meet the Medicare coding documentation article. So I don't have the subluxation and the supporting information. That's when you'd want to use that. Okay. Now, let's go back to our non-covered or not covered or never care covered services required to be on an ABN. And the answer is no, they're not. They're not required to be on the ABN. You could give an ABN. It's a nicety. You can inform the patient. But as a matter of fact, you don't even have to complete the entire form. You would complete sections A through F and stop. On a non-covered service, never covered, whatever you want to call that, no, the patient does not need to sign, nor do they have to make a patient's choice. Well, why? Because it's not covered by Medicare. So you're just telling them it's not covered, this is how much you're going to have to pay for it. Now, I do want to remind you, you'll hear this referred to as an optional use. And the reason that we refer to it as that optional use is simply because it's not covered and you don't have to do it to change that patient liability. I was asked if the codes are changing for claims, and I'm not really sure where you were going with that one, but I'm going to say no, the codes are not changing. If you're referring to the new law that's coming out that could potentially allow for more coverage, great. But until that is finalized, passed, and signed into law, and then implemented by CMS, there's not much we can do with that. So I don't know exactly where you were going with that. Will Medicare ever cover the cost of the initial exam and x-rays? Again, I don't know. The basics of the law right now says that that those are not part of what's covered. It does allow those 3 codes for the manual spinal manipulation, but you do need to prove that the manual spinal manipulation is needed. So I don't have an answer for that. I will tell you that if you read through the potential law that is before, and I want to say it's before the House right now, but I could be wrong. It could be before the Senate. There is some additional information in there that could definitely make that covered. But again, it's all about that being finalized. Um, the next question, why do Macs turn around and pay on a GY when it's sent for redetermination? What are we missing that was medically necessary? Okay, so there's a couple of different things that are happening within this claim. First, who's sending in the redetermination? That is a level 1 appeal. If it is the provider sending it in, we will automatically assume that it is a covered service and that you meant to put the AT on it, not the GY. If it's not, if it is a patient submitted appeal, we should not automatically be paying or doing any of that. What'll happen is we may request the medical records from the provider to see whether or not it should be paid because the patient has asked us to do that. If the provider is submitting on behalf of the patient and the provider is the one who submitted the claim and is a party to the payment, they cannot submit that as a patient appeal. It will come in as a provider appeal, even if the patient is asking you to do it. What we need in that case is for the patient to sign and date the request. So if you have a letter that goes out that says, would you like us to appeal this with Medicare? And the patient says yes, then say sign and date here and attach that as the cover sheet. This is why we're doing the appeal. Don't sign it and date it as a representative of the provider office because we can't take that from you. That will automatically drop the GY. So hopefully all of that makes sense. I'm not really sure what's going on with that person's appeal, but I did want to try to address it as best I could. Um, I was asked for the total claims process and the steps to appeal denials. That is a huge process. Again, I kind of highlighted different things. We do look at validity edits, which means we can't process it. Those are the unprocessable edits. We do look at the medical necessity edits to make sure, first of all, that it's a payable service, that a chiro can perform that service, or a variety of other things. I'm not sure what you're looking for. If you're looking for the full appeals process, I guess I would recommend the CMS website and maybe the Medicare Part A and B appeals process booklet. It is a really nice booklet for you. I'm going to go ahead. I actually did not probably give Ashley that link, but I do have it. So I'll try to put it in the chat while Ashley looks and sees if there are any questions for me. So Ashley, do we have any questions?
Tom, we did get a couple of questions in. The first one is, my provider is a Medicare provider, and my patient requests that the charges not be submitted to their Medicare plan, and they want to self-pay. Is this allowed since we are a Medicare provider, and do we still need to submit the charges with the GZ modifier?
Oh, that's a great question. And the answer is if you document it. So have the patient sign a statement saying, I don't want you to submit to Medicare. It's their benefit, right? So instead of saying signature on file, meaning, hey, I have a statement allowing us, it's the opposite. I have a statement saying don't submit. If the patient doesn't want you to submit and signs a statement stating such, then yes, it's perfectly fine not to bill. Please note that it only applies to that statement or that claim unless it's specified, I never want you to bill Medicare, in which case it would work very similar to a signature on file, except the opposite and just make it so they never have to. And they do have to provide a written statement to redact it then. Hopefully that answers the questions. If not, give me some more. But also do not submit those claims to Medicare. You are not authorized to submit those on the patient's behalf. Any other questions?
We had one more question, which is, can you see claim rejection information on WPS for claims that were processed through an outside clearinghouse?
Okay, so yeah, that's a great question too. And I'm gonna go back and say, yes, you can. And what we're gonna look at is this tool right here, which again is that that portal, that secure section. So if an outside clearinghouse submits it and you want to look up anything, as long as you have access to that provider's NPI, you can do that. So I'm not sure if you have access to that or how you have that set up, or if you don't, But if you can get a remit notice, you can actually set yourself up to be the MPI administrator for the first person to register. If not, you would need to go back to one of your MPI administrators and ask them to give you access to look it up. But it is through the portal that you would do that. I guess you could use the interactive voice response or the IVR system, which is our phone system as well. So those are the two options that I really have for you for looking it up. If you want something more than like what your clearinghouse or your vendor sends you. Sometimes that happens when they strip some of those remake notice codes off, whether it's the remarks or the reasons codes, and you want to know what actually happened. That's why we recommend using the portal or the interactive voice response system. Ashley, any other questions?
That was our last question.
Okay, perfect. Because we're right at the point where we can move on. So resources, just exactly what I gave you. If you want some more information on the on the advanced beneficiary notice or the ABN, here for you. Here's that article that we talked about. And this is just a job aid. I think it's really nice. Something to give the doctors, the actual chiropractors that may help them through documenting. This is not something that I go through. It was something that Jennifer went through. Jennifer's one of our clinicians. She did that one a couple of weeks ago. So this is actually a link she had me give you guys. So I don't have a whole lot more to offer other than, it's there. So you will be getting a certificate of achievement that comes out in an email. It's going to look like this on the left side. And you can see the certificate is the bottom part of the email. So when you get a follow-up email or the automated email, just please be aware that it does have a certificate. It gives you contact hours. Governing bodies have to choose whether or not they accept our contact hour to make it into CEUs. We don't offer CEUs. We simply offer you a certificate with contact hours. Okay. This will also give you an opportunity to take the survey, which I will actually talk just about in just a couple of more moments. But I do want to remind you that for the next 7 days, you can send me follow-up questions. I would recommend that in the subject line, you put chiropractic claims or something similar to that, chiropractic claims webinar, something like that. What that will do is help whoever is monitoring our email box, because the email box that we give you is a shared email box. All of us have access to it. Just go ahead and put that in there to help us get it. By us, it's Ashley and I who get to answer those back to you. So we want to make sure we have access to them and we can get you what you need. Okay, surveys. These are very important to us. I'm going to recommend that you really do take the time to complete that survey. While you think, oh, I've done it 100 different times on every single webinar they do, maybe I'm sick of doing surveys, maybe I'm tired of them. The reason that it's so important is I need to know what you thought of this webinar today, but I also need to know what WPS is doing as a whole, and does that change from time to time? So please take our survey. A couple of ways you can do that. One, you saw the email, top part of that email contains a link to the survey. Two, Ashley's going to put a link directly in the chat box. You can select it right now and take it while I finish up talking. Three, we're going to go ahead and give you a pop-up box. It's not anything major. It's going to look like this. This is an external site, and this is a continue on the bottom. This is just a link to the survey. It's our WebEx tool's way of telling you that you're leaving WebEx and going to something else that we want you to, and that's the survey. Last, if you are listening to this as an encore, which you are welcome to do, and we highly encourage you, you can also take the survey by clicking on the picture that looks like online survey here on the upper part, and you can select to take the survey that way. But again, don't be scared to give us feedback. What did we do well? What didn't you like? What did you like? What could we do better? What other topics would you like to see? Okay, any of that is all fair game. As a reminder, we do continue to look at the surveys. We do continue to make changes. One of the big changes that we were asked for was chapters in YouTube or smaller biteable chunks in YouTube. So if you open the description, you'll actually see those chapters. We did use some training indicators, but we also did the Medicare Education Expos, which cover general topics. So chiropractors may be interested in those as well. That's it. That's all I got, folks. I do want to thank you for attending. Thank you for giving me your time today. I hope you got some valuable information and your questions answered. Please remember to take that survey. With that said, you may now disconnect. Have a great day, everyone.